If you're visually impaired, I'm going to educate you. No one has ever told you this before. Okay, people, this is not taught in like rehab facilities when you go blind and you lose vision. Okay. I am also speaking as someone who is blind. I am 75% blind. I have 25% vision, and I do have a degenerative progressive eye disease. Okay, so lived experience, lived body experience is speaking to you right now, my blind people. You have a different nervous system because of constant sensory demands, environmental navigation challenges. Okay, social dynamics. Oh, do we have social dynamic issues? Okay. All of which keep the body's stress response active. So when you are visually impaired and you are relying on your sense of touch, hearing, smell, the other senses, your nervous system is working harder to gather and to interpret information, even for everyday activities that just feel automatic for the sighted. So this is higher sensitivity, sensory overload, increased unpredictability. Not seeing what's coming means that you live with more unknowns and surprises. We do not like unknowns and we do not like surprises, do we? No fucking way. So a regulated nervous system thrives on predictability, but when you live in a state of unpredictability all the time, well, you're living in a constant state of fight or flight. The next one, micro stresses add up. Little things happen throughout our day, every single day, and you get it. You know what I'm saying. We're cyclical. We're not linear like others because we have to have meltdowns or just like explode, like every couple months, every few months, and just like let it all out, because all of these little micro things that keep happening on a daily basis, like it adds up, and getting inaccessible places, having to advocate for your own needs, dealing with transportation barriers. And like, this may not seem like a lot to someone, but this adds up, and this is chronic stress. And then we have social and emotional factors. Blind people face societal assumptions, lowered expectations, and exclusion, all of which trigger the survival response. And your nervous system responds to social threat the same way that it responds to physical threat. And we have early life adaptations. Your nervous system may have adapted to function with hypervigilance. This can wire to a baseline that's more activated compared to someone who hasn't had to scan their environment in the same way.